Welcome to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in the century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I am Dr. Richard Pan. I'm a physician with a background in public health, and I am proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County in the California State Senate. I want to share with you important information and stories to help each other during this difficult time. Initially, it appeared that the novel coronavirus didn't seriously affect children, although more recently, young children have died of COVID-19 in the United States, and now it appears some children who have had COVID-19 have developed symptoms similar to an autoimmune condition. Pediatricians are finding their patients and practices greatly affected by the COVID-19 pandemic. So I am thrilled to be joined by Dr. Eric Ball, a primary care pediatrician at Southern Orange County Pediatric Associates. He is a board director of the California American Academy of Pediatrics and a leader in quality improvement. Thank you so much for joining me, Eric.
Thanks so much, Dr. Pan.
So let's start off with, why did you decide to become a pediatrician?
So besides the obvious answer that I love kids, I find that medicine tends to be quite reactive, where we wait for someone to get sick and then treat their disease. And pediatrics was attractive to me because it's more proactive and preventative. And I feel that my job as a pediatrician is to help parents to raise their kids in a healthy way and to provide services such as nutrition counseling, immunizations, help with education to allow them to grow up to be healthy and active adults.
So tell me about your pediatric practice, and also how's COVID-19 affected your practice?
It's changed everything completely. So I went to work on Friday, March 13th, relatively normal day in my office, saw typical slate of patients. Come home that night, have a meeting with my partners. We sit in our office 8 hours a day, Saturday, Sunday, and we basically reinvent pediatric care. Come back on Monday, I'm working in a different office. We've split up our practice into offices just for healthy kids, offices just for sick kids. I'm only seeing well child checks. Some of my colleagues are only seeing sick patients. Some of those patients are being seen in their cars. We're all wearing masks. We're screening our patients now, where everyone who comes in our office answers a questionnaire, and we take their temperature. We're only allowing one parent with each child in the office now, and it's going to be like this for the foreseeable future. So the structure of our practice has changed completely, and I think we're doing a good job trying to keep our staff and our patients safe while still being able to provide care for them.
Mm-hmm. Now, can you maybe tell me a little more about your practice itself? How many pediatricians are there? Because you talked about having to split the jobs and actually dividing between well child and sick care. So maybe give our listeners a little description about the practice itself and how many people are involved.
Yeah, so my practice, Southern Orange County Pediatrics, is affiliated with Chalk Children's Hospital in Orange County, California, and we're a rather large practice. There's 15 pediatricians in our practice, and we're fortunate to have 4 offices, so we have the ability to split up our offices into sick offices and well offices. Our big fear with the COVID outbreak is we don't want anyone getting sick in our office, and we want people to feel comfortable coming here because it's critical that they still come to the pediatrician when they need to. It's critical that they stay on schedule with their immunizations, and especially for our babies, we want to make sure that the families are comfortable bringing them in. So because we have a larger practice, we were able to split healthy kids and sick kids. A lot of my colleagues who work in smaller practices are doing similar things, but they're doing it time-wise. So, for example, they'll have just healthy kids in the morning and just sick kids at night. But pretty much every pediatrician and pediatric office that I know of has made some big structural changes in the way that they practice in order to keep their patients safe.
So you talked about the things you're doing to try to keep your patients, employees safe. We've heard about shortages of personal protective equipment known as PPE. And then, of course, we have stay-at-home orders. So the message has generally been to people, stay at home. So what are you seeing in terms of the parents? Are they are the parents still coming in? Are they basically saying, well, I'm really scared about my kids getting sick, or even me getting sick, visiting the office? What are some of the things that you're doing to both keep patients and employees safe, but also reassure the patients and the families that it's safe to come to your office?
So this has been an evolving issue, I think. When this first started in late March with the stay-at-home order, we saw our visits plummet. So I would see normally between 20 to 30 patients in a day. I was seeing 10 kids in a day. It was people were just afraid to leave their house. They did not want to come into the pediatrician's office. And I think as time has gone by, we've adapted, and I think our families have adapted. So we've instituted a pretty robust telehealth platform. So we're doing a lot of visits now virtually. So especially for minor issues, we're doing a lot of mental health conversations, which are unfortunately becoming more common via a telehealth platform. So I can use my computer and look at them, and they can stay at home and stay safe. I think as time goes by, we are having more and more people come into the office when they need to, largely for kids who need immunizations or need their checkups, because that's hard to do or impossible to do electronically.
Mm-hmm. And how has the pandemic affected your employees?
Yeah, so that's been a huge issue as well. So for one, most of us are parents, and I am too. I have young children, and they're out of school right now. So for a lot of our employees, that becomes an issue. How do you go to work and still take care of your kids who are now at home? And a lot of them rely on us to help with their homeschooling at this point, with their distance learning. So that was an issue that we've had to work through as well. And then also our priority is keeping our staff and our patients safe. So again, we're instituting a lot of pretty strict procedures and protocols to make sure that people don't come to work when they're sick, and we're screening them. And what have you. But it's been quite difficult, especially because all of us are here at work, and we're staying focused on our jobs, but in the back of our mind, we're thinking about our families at home, and we're worried about them, and we're worried about our parents, and it's a difficult time for everybody.
And you mentioned that you're not only seeing the patients in your office, but also doing the telehealth, and you made reference to the increase in perhaps mental health issues that might be coming up with stay at home and kids not being able to go to school and so forth. So in general, what are you hearing from your patients and families about the overall impact of this pandemic on their health?
It's really tough. As pediatricians, we know that kids really thrive on structure and predictability, and I think a lot of that is gone for them right now. So, they like going to school and being with their peers and learning and having a structured life. And we are really, really, really stressing the importance for families to make sure that kids stay on some sort of structure, some sort of schedule when they're at home, wake up at a reasonable time, go to bed at a reasonable bedtime. We want to make sure that they are getting some sort of exercise, ideally as a family, every day to try to stay on target. But we're definitely seeing a lot of kids who are having anxiety, more adjustment disorders, just kind of a hard time with this. So that's becoming increasingly a large part of our job is a lot through telehealth, but talking to families and to kids about the mental health effects of the stay-at-home order and just the uncertainty of the whole situation right now.
Mm-hmm. Now, in terms of child care and preventive care, as you mentioned, checkups are a large part of a pediatric practice, doing the screening and educating families about prevention, things like immunizations and so forth. So how do you see, how are you delivering that care, and what kind of response are you getting from families? Sometimes people say, well, we have a crisis. Can we do this later? So what are you getting back from families around trying to provide child and preventive care?
Yeah, so initially we were having a lot of people cancel their appointments or postpone them, although I think we're seeing more of them come back now as we implement strategies to keep kids safe in our office. But I think, seeing kids directly in our office for child care is really important, and not only to give them their immunizations on schedule, but because, number one, we do pick up things on our annual physical exams that sometimes are not picked up by a parent or a child. For example, last week I had a school-age child here and had a pretty significant hernia that no one had seen at home, and he didn't mention to his parents, and promptly got repaired. But if we didn't have that routine checkup, I worry that that could have become an emergency down the road and would have been a problem for the family. So we pick up things. Number two is we do a ton of what we call anticipatory guidance. And so, our role as pediatricians is to help use our knowledge and our experience to guide families through the parenting process, whether that be through talking about education or nutrition or discipline or sleep or behavior or whatever. It's really nice to be able to have that conversation with a family face-to-face, especially a family who we have a good relationship with. And then finally, growth and development is incredibly important. We do a ton of screenings as pediatricians. We screen every kid for autism several times during their life. We are now screening all kids every year for what are called ACEs, or adverse childhood experiences, which are traumatic experiences that can happen in their childhood that can affect patients' physical and mental health down the road. And then also for developmental delays, and try to get them into early intervention promptly. So the issue is if these checkups get postponed too long, then these problems get addressed later than they should, and you have a kid whose developmental delays are not addressed, and that can lead to bigger problems down the road.
Yeah, certainly the children don't stop growing and developing just because we have a pandemic, so there's no pause on that.
Correct.
And I appreciate you mentioned adverse child experiences. One could probably argue that the experience many children are going through with this pandemic, being separated from their classmates in school or other types of things that the family has to do, could be considered a adverse childhood experience?
Yeah, this is a tough one, because I think for all of our kids, frankly, for me, for you, for everybody, this is an extremely traumatic experience that's changed all of our lives in a rather sudden way, and that is going to lead to, mental health, physical health issues down the road, I'm sure, from our children. And then on the flip side, if you look at kids who already are undergoing adverse childhood experiences, so for example, kids who are in an abusive household, this is just exacerbating it, because now they're stuck in that abusive household. It's also really, really shining through inequality in our society. So, for example, our kids are getting distance learning. My kids are relying on the internet and their computer to learn now, and if you don't have internet access, or you don't have a computer, or you don't have parents who can sit and teach you all day, you're going to fall farther behind. So I do fear the repercussions of this pandemic down the road.
Now, we talked about well child, but we also know that children who have chronic conditions also need to regularly see their doctor and their pediatrician to manage those. And in fact, many of these chronic conditions may make them at high risk. For example, if they have diabetes or an immune issue. So how are you going about ensuring that children with these kind of chronic conditions are still getting their care coordination and the checkups that they need to manage their condition?
It's interesting. This is maybe one of the only silver linings of this situation. We're definitely not as busy as we used to, so we have a little more time on our hands. And we've actually, in our practice, been proactively seeking out these kids. So using our electronic health record, for example, we've been identifying all of our kids with asthma, and those who haven't been seen in the past several months, we're just proactively making a call and seeing how are they doing. Do they have their medication? Are they taking it? How is this affecting them? And then scheduling a telehealth visit if they need a tune-up or they need to talk to somebody. And we're doing similar things with our kids in my practice who are on the autism spectrum, kids who have developmental delay, or kids who have a diagnosis of obesity. We just want to make sure that they are in a good place right now and that they have the support they need. And we want to make sure that we maintain what we call a medical home, which is basically, a one place where they can turn to if there are problems and can help coordinate their care.
Now, you did talk about immunizations, and fortunately we've been hearing that immunization rates have fallen during the pandemic. There are several news stories about that, and many experts are concerned about outbreaks of diseases like measles and whooping cough in addition to the coronavirus pandemic in the future. In fact, just last year we had a record number of cases of measles in the United States, more measles than since 1992. So that was just last year. So what are some of the things that your practice and that other pediatricians are doing to ensure that children are getting immunized on time?
It's interesting you mentioned that. I literally just had a conversation yesterday with a family of a child who turned 1, I think 2 days ago, and has his 1-year-old well child check with me on Monday, at which point he's supposed to get his MMRs, measles, mumps, rubella vaccine, among others. And they called to tell me that they were not going to come because they wanted to wait until the pandemic was over before they brought the child in. And, that could be months, and that could be a long time from now. And so I had a long conversation with them about, the risks and benefits of, staying at home and not getting vaccinated. And I feel that the risks of not getting those vaccines on time greatly outweigh the risks of coming to our office for a 15-minute appointment and get the vaccines. As you know, the CDC showed there was a tremendous drop in immunization rates in March and April of this year, and especially measles containing vaccines, there's a pretty significant drop. And I definitely fear that when we come out of this, we're not only going to start seeing, more COVID cases, but we are going to start seeing more measles cases and whooping cough and what have you. We're reaching out to our patients. We are proactively calling back patients who have canceled appointments or no-showed to appointments to get them to come in and get their immunizations, especially for our young children, especially our children under 2 who need these critical childhood immunizations. And then we're also proactively looking at kids whose immunizations are not up to date and calling them and trying to get them in the office. We're already worried about flu season, which is coming up. We're worried about having flu cases on top of COVID cases in the community, which is scary, and we're already talking about our strategy for flu clinics. And we're probably going to start doing some outside-of-the-box things like drive-through flu clinics or flu clinics outside where we can physically distance our patients and still be able to get their flu vaccines on time.
I appreciate you raising the flu vaccine as well because, the director of the CDC basically expressed concern about a concurrent wave of both coronavirus and flu next fall. This year, actually, coronavirus came at the tail end of flu season, and what we're worried about is coronavirus coming back in the fall at the same time as the flu. And while we don't have and we won't have a COVID-19 vaccine by next fall, we certainly have a flu vaccine. And right now, only about 40% of people get their flu vaccine. For children, it's a little higher, but we really should be at 70 or 80% or even higher. So I appreciate what you talked about, thinking about what can we do out of the box. I don't know if you have any thoughts about, from a policy perspective, as a pediatrician, what we should be doing to try to boost our flu immunization rates so that our hospitals aren't overrun with both flu and coronavirus at the same time.
Yeah, I think we have to increase the capacity and the availability of flu vaccine everywhere. I mean, I'm a big proponent of being able, be able to give flu vaccines at schools and places that are not the traditional places like pharmacies or doctors' offices. I also we have a meeting actually coming up next week to talk about this for the future, and we're talking about ways that big groups of practices and community leaders could all get together to try to coordinate more community-driven flu vaccine clinics. We want to get this out of just that you go to the pharmacy or you go to your doctor's office and get a flu vaccine. We want it basically to be available wherever you need it, because a lot of our patients, especially the older ones who don't come to the office very much or aren't sick, they don't even think about a flu vaccine. So not only do we need a public health messaging, we need to get the word out about how important it is, because, the symptoms of COVID-19 and influenza can be quite similar. And, we were somewhat fortunate that we caught COVID at the end of our flu season, so our hospitals had some capacity. But in the midst of the winter, our hospitals baseline are quite full with flu patients, and thinking about getting a lot of COVID patients on top of that is a really scary proposition.
Now, actually, in terms of COVID testing, people are talking about wanting to get tests for themselves or their children. Is that something you're able to offer in your office, or what do you do when parents call and said, I want my child tested for COVID-19?
Yeah, so we do have availability to test, but it's still pretty limited, and we don't want to use tests on asymptomatic people. And right now, our public health officials are recommending, and I totally agree with, that we are saving these for people who are at higher risk or who we really need to test. For example, anybody who goes to our hospitals now for any procedures, they'll do a COVID test to make sure that they're not an asymptomatic carrier. And then obviously people who are symptomatic or who are living with higher risk individuals. But, if I have a family and they just want to test and no one has any symptoms, it's kind of a waste of pretty valuable resources at this point. I'm hoping that over time we will get better tests that are a little less invasive than the current nasopharyngeal swab test, and I'm hoping that we'll get better serology tests, because we do have a lot of tests that look for antibodies, but they're pretty imprecise at this point, and they don't give you a lot of good data because of their higher false positive rates at this point. So hopefully down the road we'll have some better tests, and that's really the key to opening up society.
Now, I've heard many pediatric practices have lost significant amounts of revenue, as much as half, because of COVID-19 with the drop-off in visits. You talked about telehealth. I don't know how much you get reimbursed for telehealth. What needs to be done to keep pediatric practices, I guess, open and alive so that children can get needed care both now and in the future?
Yeah, so two things, I think. So number one is telehealth has been really great, and it allows us to treat patients from their home, which is fantastic. And there's a lot of conditions which I believe we can use telehealth for down the road. When COVID is over, we can still do telehealth visits for a lot of these things, and we want to make sure that insurance companies will still pay for that. Right now, we have a bunch of garbage telehealth. So there's a lot of companies out there that provide pretty terrible care over telehealth. So you call because your kid is sick, and they almost always give you antibiotics or what have you unnecessarily because they don't have a relationship with the family. So it's better medicine. It's more cost effective for the patient's actual provider or pediatrician to be able to do that telehealth directly. So I'm hoping that that'll be continue to be paid for down the road. I'm also hoping that they can start paying for well-child checks, or at least giving anticipatory guidance and having conversations about growth and development over telehealth, because right now insurance companies are not reimbursing us for that. And then the second thing that I think is really critical is most of us are doing really horribly economically right now. This has been an incredibly difficult time. Insurance companies are not. They're actually doing quite well because kids aren't coming to the office. So I'm still paying the same exact premium that I paid in February, as is my practice to pay for the premiums for all of our employees. But we're not going to the doctor as much, and we're not using as many healthcare resources. So their profits are going up. And my car insurance company, for example, gave us a refund of some of our car insurance premiums because they acknowledge that very few people are driving now and the risk of a car accident is lower. I haven't seen anything to that degree with our private insurance companies, and I really wish that there would be some sort of reimbursement from our private insurance companies to pediatricians and other practices which are hurting right now. Because when this ends, we're still going to need doctors. We're still going to need primary care physicians coming out of this on the other side. And I really worry because we're all small businesses and we're all hurting like all the other small businesses. And we need to remain viable for the future of our patients.
Now, are you getting any payment for telephonic care? So we talk about telehealth, and sometimes people think telephone care may or may not fall into that category. Pediatricians have always provided significant amount of care over the telephone, but have very rarely ever been reimbursed for that. Has that changed at all?
I'm not sure. We do not bill for anything that we do over the phone. Only if we have a face-to-face conversation using a telehealth visual platform. I'm not sure, honestly, although we do provide, obviously, a tremendous amount of care over the phone on call at night and during the day as well.
Well, certainly other professionals like lawyers and accountants and others have always charged for conversations on the telephone. So perhaps that's an antiquated issue that pediatricians and other healthcare providers providing literally their expertise and advice over the phone should be paid for that because that has value.
Yeah, I totally agree.
So do you have any final words in terms of what parents should be doing to ensure their children stay in good health during this pandemic? Yeah,
structure, predictability. there are, going back to ACEs, so adverse childhood experiences, there are some what we call resiliency factors. There are things that you can do as a family, as a parent, to basically make the effects of a traumatic experience not as bad for your kids. And I think that all of us need to work on that now. And those are sleep. So your kids need adequate sleep. We see a lot of kids now who are staying up super late because they don't have to wake up for school. So having a reasonable bedtime and waking up at a reasonable time. Good nutrition, so eating some semblance of a well-rounded diet. Exercise, our goal is that kids get at least an hour a day of some sort of active exercise, and right now there's a lot of time for even more than that. Mindfulness, so taking some time just to breathe and think and turn your brain off a little bit. I meditate with my kids. I find that's helpful. And then finally is having loving, supporting adult relationships. So being present for your kids, being with them, helping them, hugging them, telling them you love them, reading to them, all of that is really important. And it really does make the stress of these traumatic experiences a lot easier for a child to handle.
Well, thank you so very much, Dr. Ball, for spending some time with me and sharing what you're experiencing and the importance of pediatric care for our children. And I want to thank all our listeners for listening to this episode of Putting the Public into Health by Dr. Richard Pan. If you have questions or ideas for a future podcast, please email them to senator.pan@senate.ca.gov. Please stay at home as much as possible, except to get your kids their checkups. Stay at least 6 feet away from others outside, wash your hands frequently, and try not to touch your face. Together, we are slowing the spread of disease and saving lives. Thank you so much for listening.